have received a lot of messages asking me, how do you get through the internship year? Is the year very stressful, or what can I expect when I get into an internship program? However, I have also uploaded a post on my Instagram for 10 tips to get through a successful internship year. You can find it on my profile as well. I have actually noted down a few tips and tricks which you can utilize when you start your internship year. Now, first, you need to understand that internship year is all about trial and error. You are going to fail, you're going to try, but most importantly, you're going to learn a new skill and a new way to deal with patients. As a medical student, you have viewed the patient just to take history or do a physical examination at most. But as a medical intern, you would be also responsible for understanding what labs, what investigations, and what management should be ordered for the patient as well. Secondly, when you start working as a medical intern, you would be involved as a member of the treatment team. You would be responsible for seeing how the patient is presenting with, what are the signs you see in the patient, what are the symptoms he's presenting with, what medications has he been taking already, what lab investigations you would want to do, what imaging modalities you want to use to rule out his diagnosis, and what interventions are required if they have to undergo a procedure or not. One added advantage is that you can spend more time with your senior doctors in the hospital who already understand how the system works in the hospital. Third, try to spend more time in rotations that you are more likely to pursue a residency career in. Now, why is this important? If you spend more time in rotations that you're more likely to pursue a residency career in, try to grab your recommendation letters from doctors by showing your interest. Fourth, internship programs usually come up with an elective month. Now, this is the month where you can choose a specialty of your choice to rotate in. I would advise you to choose a department which is not part of your internship schedule. The advantage of this being simply because you would get exposed to that department which is not in your internship schedule. Fifth, to publish an article. It can be as little as a case report or a literature review. Case report on one of the rare cases you have seen during your rotations, or a literature review on one of the topics that you have come across which was new to you or which was interesting then you read in medical school. Try to grab your doctors as your mentor, work the project with them, and try to publish them at the end of your internship year. You're learning, and having these things are added advantages. I'll talk about researches in depth in a different video about what type of researches to do and how you can do different researches and how to grab a mentor, so stay tuned for that as well. Sixth, most interns fail to maintain a logbook. You can include as little as 3 important details: the hospital registration number of the patient, the diagnosis of what the patient presented with, and a brief history of what he came up with. Keeping these things in order, you can add this to your portfolio so that this can help you when you're applying for international exams. If you want to get into a residency in US or even UK, you can submit these books or these documents as a proof of what you spent your internship year doing. One thing that is very important to understand is the transition from a medical student to a medical intern. It's a very huge step. You need to grab all the support you can get from the nurses in the wards, in the ER, from your junior residents, from your senior residents, from your junior doctors, from the senior doctors, even your consultants. Don't be shy to ask about a diagnosis, to ask about a treatment procedure, to ask about a drug that you don't know. You might not know about it today, but if you ask, you learn, you will remember it for the rest of your life. Try to attend morning meetings because the discussions on patient care and management during these morning meetings are very crucial for you to learn. You can learn about a new drug that has come up, a new research that has come in the field of that department, or even the assessment and plan that the department is working on for a patient. This will allow you to understand how you treat certain diseases and how you come up with diagnosis, interventions, and management in that department. And by far something that has been seen as a nightmare is on-calls. Yes, so on-calls is usually a 12 or a 24-hour shift at the hospital. Most of the medical students might have not been exposed to how an on-call is. So whenever you are posted on an on-call, remember to have adequate rest the previous night or the previous day, to carry some snacks with you that will help you if your shift falls at the night, and always attach yourself with the resident, because the resident or the first on-call, which is usually a junior doctor, would be the first to respond whenever a patient comes up in the ER or if an inpatient needs help in the wards. You need to remember that all these patients that you would be seeing on your on-call need help, so you must take care of yourself before you help others. Have a proper rest, eat well, and try to read upon topics that the patients are presenting with so that you can provide the best treatment possible for them. Last but not the least, interns are usually on the bottom of the hospital tree treatment team, which can be an advantage that you wouldn't have major patient responsibilities on your shoulder. One more added advantage for this would be this gives you a space to relax, to learn, to read about a new topic that you saw in the wards or in the OT or in the ER, and then to discuss these topics with your co-colleagues and with your treatment team. In the end, don't forget to detox yourself. Breaks are necessary. Avoid burnout. The hospital work schedule can usually be hectic, so try to socialize, try to make friends around. You need to make sure that you are in the best condition possible to help the patient when they come. If you're already physically drained, mentally drained, you will not be able to provide the best care possible. So take help whenever necessary. Talk to your senior doctors, talk to your friends around. Always remember one thing: the greatest weapon against stress is to choose one thought over the other. So if you feel that you are in a situation that you should not be, always reach out to help and try to communicate with your seniors so that they understand what they are putting you through and you get the best out of the rotation you're putting. I hope this video was clear about internships, and if you have any questions on how to get through internship, put it down in the comment section below, or you can also DM me on Instagram. If you have not watched my previous videos, I will put it out here and you can watch it as well, and see you in the next one.